Hi everyone, my name is Emily Shelton. I am the Community Services Coordinator for Sertoma Centre. And today I would like to introduce you to our mobile crisis unit. We don't have details for it yet, we're working on it. So the mobile crisis unit is something that Sertoma created. It was just launched back in July. So what we do is it's a unit to outreach to the homeless. So with my team, I am currently overseeing our homelessness initiative. So we help people who are in a housing crisis, and that can mean that they are facing an eviction, that can mean that they're couch surfing, that can mean that they are legitimately on the streets, and kind of anything in between there. So we created this unit to help outreach to them in a more effective manner, especially with COVID going on right now. We've got food, we've got drinks, we've got clothing for them. We have different tools to do assessments with them if needed. We also have a clinician and a peer support specialist on the unit at all times. Come on a little tour with me, we can show you everything that's on here. All right, so this is the inside of the van. So as you can see, we have plenty of room to transport clients if needed. We have actually transported a few people for different reasons to get important documentation signed when they're in shelter and don't have a way there. We've transported people we have outreach to on the streets to a shelter to get food, to get information, different things like that. So on the van here, so we have our cooler that we bring out with us every day. And on our cooler we have some juice, we've got some different kinds of snacks, so some granola bars, some trail mix, some water. We also actually, this is very cool, we have Narcan as well. So if we ever encounter anyone who is facing a drug overdose, we can help them. We are Narcan trained, so that's a really cool thing. So in the back here we do have this tote. It has some clothing in it for those that need it. This assessment, so this is our GEPRA. So this we do with everyone, we try to do with everyone we encounter who is homeless. And it's just basically a 10 to 15 minute assessment, just going over kind of their mental health symptoms, their physical health over the last 30 days, where they've been staying and things like that. So for participating in this, they do get a $5 fast food gift card. And then there is a 6-month and a 1-year follow-up just to kind of see, the progress and how they're doing in that timeline. And for that, they do get a $25 Visa gift card. So people really like that. All right, so in the back here, we do have, so we've got some hygiene kits. So we have hygiene kits for men and for women. So it's got, for women, it's got some feminine products. For both, there's some wash rags, some hand sanitizer, soap, shampoo, conditioner, anything that somebody would need for personal hygiene. We've also got some chips back here, and in a different tote, we do have some dry goods, so some cans of soup, some ravioli, things that somebody who may not have access to like a microwave or something can still eat. And definitely is easily accessible if they do have a microwave, just to kind of heat up and go. And then we also have this little tote back here. So in here we've got masks for consumers that we encounter who may not have one, some hand sanitizers we can give out, a first aid kit, some pens, just some other goodies for them, which they really seem to like as well. So this is our table. So another thing that we do for outreach is we go around to different food pantries, shelter registrations. We just, we set up at some churches and things just to kind of provide that outreach, let people know that we're here. So this is our typical table setup. We have some information for those that want it. This is our referral form that we use to gather information about clients, what kind of services they're seeking, how we can help them, that sort of thing. Again, we've got some little goodies, so we've got some pens with a really cute bear. People love those. Business cards for anyone to take that we encounter that can include other agencies as well. We've got some little resource books here that have resources for all over the South Suburbs, including like DV shelters, mental health services, food pantries, different things like that. All right, so I am here with some of our staff from the GVHI team, so that is our homelessness initiative. So again, I'm Emily Shelton. I'm the Community Services Coordinator. I am currently overseeing this program. Here with us in spirit is Rachel Good. She is our Community Mental Health Liaison.
So she helps us form all kind of different partnerships with different social service agencies, churches, other outreach partners, and different things like that, so we can keep expanding, which is really great. We've got Alexa Thompson, who is the Director of Community Services, so she kind of oversees everything. And then we have Ludwina Rudolph. She is the new Crisis Outreach Manager, so she will actually be overseeing this program. Okay, and here with us is one of our peer support specialists. This is Ashley Starazinich.
Hi, so what I do is I use my lived experience to help other people through their recovery. So when we encounter people, I provide them with encouragement and hope and resources and just things that I've learned from my past struggles that I think might be beneficial to them. And I just am out there, I'm just showing them that we care and that we're out there to help. So that's my role.
And we have Constance Alexander.
Hi, I am one of the crisis stabilization case managers, so I do participate in the mobile outreach as well. And my role is we get customers' calls to go into food pantries and other set up places to assist with people who are experiencing different levels of homelessness. I conduct assessments with them as well as referrals and linkage to help them to get services even outside of our resources as well, to assist them in what they need, their immediate needs as well.
And we have Matt Anderson.
Yeah, I'm a grant data specialist. I pretty much take care of all the internal data that we collect in order to better facilitate for our grantees.
And that's our staff. We have a really great team. They have done such an amazing job with getting the mobile crisis unit up and running. Another special shout out to our South Suburban Pen's consultant, John Perkins. He does a lot with helping us find people, helping us with different resources. He is a great asset to the team as well as everyone else. We could not have done this without them. This was a big team effort, and I'm so proud of the work that we're doing, the work that they have done to help us get this up and running. And I just want to thank them. They're doing a really great job.
Okay, so I also just wanted to say thank you to our funders. Thank you for our partner agencies. We have so many of them. You all do a really great job with not only helping us outreach, but helping us link to the different resources that we may not have access to. So for everyone out there watching, what you can do to help, let everyone know about our services. Please let them know about the great work that we're doing. We are Sertoma Center. We are Community Mental Health and Counseling, and again, we have our Homelessness Initiative and our Mobile Crisis Unit. We've been doing such great work with it. I just want everyone to know how much of an impact it has made. We have encountered probably close to between 500 and 1,000 people who are homeless with this unit in the short 2 months that it has been up and running. So it's just been such a great thing. It's had such positive feedback. And I just want to say thank you again. Please spread the word, let people know about what we're doing. If you have someone who you know may be struggling with a housing situation, please call us, let us know. We would love to get out there and help them. If you have different things that you're doing, that you feel that we can help with or you can help us with, we would love to hear from you as well. And thank you so much.